What do we know about the menstrual cycle and bowel pattern fluctuations? It's very interesting that bowel pattern fluctuation is very common during the menstrual cycle, and that's regardless of whether you have inflammatory bowel disease or not. It's interesting that there is an overlay of IBD symptoms that may increase during the menstrual cycle, whether that's during PMS or the actual week of menstrual flow. And it's interesting that menses suppression with birth control medication can actually be very helpful and needed if debilitating symptoms are present. All right, so let's talk a few minutes about intimacy and sexuality. So IBD has both direct and indirect effects on sexuality. How are you supposed to talk to your doctor about that when they're just interested in making sure that your medicine is safe and refilled? These can be very difficult things to bring up, but sometimes more important than some of your bodily symptoms that you may have. With that, I'm going to turn it over to my colleague.
So, what are your chances of getting pregnant? A woman with IBD has the same chance of getting pregnant as another woman her age, unless she's had surgery in the pelvis. How will you do during pregnancy? The majority of patients do great and they have healthy children. However, statistically, all women with inflammatory bowel disease have higher rates of abnormal pregnancy outcomes. This is why we want all pregnant women with IBD, regardless of how active their disease is, to be followed as high-risk patients. And this does sound scary, but I'll tell you that we have at least 50 to 60 women per year in our practice who have pregnancies, and they all do great. You want to make a life plan, so IBD should not impact what you do with the rest of your life. You want your education, you want your family, your friends, and your hobbies, and you should be able to have all of these things.